We are very excited to have you join us today on Election Day. I know it's an exciting time for everybody. So we appreciate you making the time and joining us today. We are going to be having a very exciting time going over to part 2 of our Recruitment and Retention Plan Template. We have our expert staff, Paddy DiPadova and Pamela Burns, online to get us going here today. So we're going to just pull up the slides. We encourage you to use the chat box and the questions on the side if you're having any problems. Also, everything on the side will be available under handouts. All of the PowerPoints and handouts and all of those things are available. So thanks for joining. We have an exciting agenda. I hope you were able to join us for the first part of the webinar. We have a recording if you did not join us for the first part and want to hear about the assessment piece of building a recruitment retention plan. We are on the line today. I'm Allison Abe-Sekera. I'm the Director of Training and Technical Assistance here at ACU, and I'm joined by Mariah Blake, our Staff Assistant. We're available at any time to talk you through all the recruitment retention processes. This webinar and all the webinars in the series are supported by our cooperative agreement. That is a national cooperative agreement from the Bureau of Primary Health Care, which means that we can provide free, I said it once, I'll say it again, friends, free assistance on recruitment and retention. So all the information on that project and all the resources available to you is available at chcworkforce.org. We encourage you to check it out, ask us questions there, but also ask us questions in the chat box. We are recording today, so please be aware of that. If you would not like to be recorded, you can log off and listen to the recording later. But ask us your questions. We'll be taking them at the end of the session, so we'll keep them going here and shout them out for you. And of course, have fun. We know it's an exciting day, and everyone's eagerly awaiting the election results, but this is a nice opportunity to, get away from everybody else and have, an hour of time here focused not on the outside world, but on how you can do something to make your life easier going forward. So with that, I'm going to turn it over to Paddy and Pamela, both consultants from JSI, who did the work on this actual resource that's available to you. So I'm going to pass it off to Paddy.
Hi, this is Paddy DiPadova of JSI. Let's see if I have control of the slides. I don't appear to have control, so I'm going to ask until I do. Is Mariah or Allison? Yep, thanks. So we're going to be talking about the recruitment and retention plan tools. They're all available to you on this presentation. If you look at the box over to your right, you can download the tools there. The purpose of creating the tools was to really provide a structure and a thought process for improving retention and recruitment practices for SQHCs, but largely they can be used in any type of practice. And if you don't feel like downloading the tools now, they're also available on the chcworkforce.org site, which is the STAR Center site. Next slide. Next slide. Thanks. And next, thanks. For those of you that were on the last webinar, we went through this. I'm going to go through it very quickly in case you weren't on the last webinar, just to give you an overview of what those tools are. If you could go back one slide. Thanks. So there are three major parts. There are actually four different parts, but three major parts to the plan tool. There's the instructions, which includes basically the whole template, but with the rationale behind what's going on. And then there's also the template, which provides a plan for you to complete and then have your own individualized copy, and the action plan. We'll get into that a little further. Go ahead. So for the instructions, again, it gives the rationale for each element. There's also some benchmark data provided to you and some examples for each of the elements that are included. Next slide. The template is a Word document, so you can modify it and save it as your own plan. You can change the cover. You can do whatever you want to it. But we did it that way to make it easy for you to use. There's a lot of fill in the blanks and a lot of tables to fill in. There's also an accompanying MS Excel tracking form for candidate tracking that's also available for download. Next slide. And then the last piece is an action plan. It allows you to keep track of the gaps and opportunities that you find as you're going through and making your plan. So you don't want to hold up making your plan just because you realize you're not doing something that you probably should be doing or something that you'd like to start including. So this gives you an area where you can just kind of keep track of those things and identify some strategies for how you might want to implement improvements and create a timeline for when you're going to complete them. Next slide. So there are three major parts of the retention and recruitment planning tools. The first part we talked about last time, which was the assessment. And the second part that we're going to talk about today is the retention plan. We'll address the recruitment plan next month. Next slide. So there's a poll question that we're going to throw up. You have 30 seconds to answer this. Do you have formal retention strategies in place at your organization?
And this is Allison. I'll jump in too to just say that would include certain incentive programs that you might have or recognition programs. Kind of think broadly about some of what your formal strategies are. Although several people we've talked to kind of say, well, we hope that the mission is reward enough. So think about your health center and answer accordingly.
Actually, Allison, this is Tamala. I was going to say the same thing. Focus on the word formal, not informal.
So great. We have 22% have formal retention strategies, 65% do not, and 13% are unsure. So hopefully this will help the 65% of you and the 13%. And for the 22%, maybe we can add some strategies to your arsenal. Okay, so why do we talk about provider retention? Well, the main reason is it's the best way to minimize recruitment. Clearly, if you don't have providers leaving, then you don't need to recruit to replace those providers. Even if it's not possible to retain a provider, though, or if your health center is expanding and adding additional providers, so it's not really a retention issue, it's still worthwhile to look at retention issues prior to undergoing a recruitment effort. If you identify any issues, they can be resolved or at least recognized prior to undertaking a full recruitment initiative. So understanding retention issues can help your health center focus recruitment on the candidates who might best fit into your health center culture and environment. Next slide.
And this is Allison. I'm sorry, I will also just jump in one more time to say, you know, I know we have a range of folks on the line in terms of your role at your health center and thinking about retention and what strategies you should implement. But using the financial impact tool can be really helpful to have the numbers in front of you later when you're having conversations with other members of your team about what's valuable, where you should put your money, your recruitment money versus your retention money versus how you're offering certain salaries and what you need to do to be thinking about keeping certain people. So think of this impact tool as not just something that just the CFO would use, but something everybody on the team can use to talk about how to really invest and make valuable your retention efforts.
Right, and if you can go back again, I'm glad you brought that up, Allison. The other thing about the financial impact tool, if you take a look, we've put in some numbers for you if you don't know, for example, the average physician salary or average, amount of time or dollar amount that somebody might have to spend in certain areas. We've put those in from doing a pretty comprehensive literature search, and it's interesting that even with a locum tenens provider coming in and doing the work, the net loss can be $150,000 per 6-month period of vacancy. So it's important to take a look at that, because that's all money and effort that could be saved if you did retain the providers that you currently have. Okay, next slide. So what impacts whether providers want to stay or not? And one of the clearest things we found in our research is that the mission and goals of the practice need to be aligned with those of the provider, which is especially true for a federally qualified health center. Income is a factor, but it's interesting, it's not necessarily the #1 factor. It really is that alignment with the mission and vision of the practice. Excuse me. Relationships with administration, call coverage in terms of, is it unreasonable? Is it a 1 in 2 call, for example, in a rural area? How well the clinician and family fit with the service community, passion for community health, affinity for the patient population, desire to serve the community, and low repayment opportunities. Next slide. So the 4 main areas, all of those could discourage or encourage provider retention. So the ones that are mainly discouraging to provider retention fall into these 5 categories. In terms of staffing, generally the issues cited are lack of training, especially for medical assistants, and also lack of partnership between the support staff and providers. For workload, that is often an issue that is exacerbated by staffing issues. So if you're short-staffed with providers, the workload increases, but also the workload can increase if you're short-staffed with other types of support staff. Management, the issues cited were the need for better facility flow and infrastructure, but also it can be a feeling of having lack of power to make improvements or not being heard by the management. Financial considerations is non-competitive salaries or salaries that don't offer incentives. Scheduling and vacation comes up also as one of the factors, and that is mainly with inflexible schedules and lack of a work-life balance. Next slide. So we're throwing this up again, that we've put up also in the last webinar. Just a reminder, this is the model for improvement with PDSA cycles, which stand for Plan, Do, Study, Act. And the retention and recruitment plan is set up to help you use a PDSA cycle. You might already be using this model for another QI model, initiative, but we're using this framework so that it involves the planning and assessment part of the PDSA cycle. Next slide. We've designed this presentation to assist you in collecting the data, comparing to benchmarks, and identifying possible root causes or differences for why you're not where maybe you want to be. And then at the end, developing an action plan so you can make improvements. Next step. This is what the action plan looks like for the retention part of the retention and recruitment plan. So what we're going to be talking about are the 5 areas that I just brought up: mission, compensation, benefits, work schedules, and also career path. Go ahead.
And we want to encourage you when you're thinking about filling out that action plan. It can be really broad. There's a lot that you can think of it, especially for the percentage of you that don't have any or only have some level of formal retention strategies. You know, probably we could sit together and come up with a whole long list of things. And we really encourage you as part of that PDSA cycle and all the efforts you're undertaking for recruitment and retention to think really how you can take bite-sized small pieces of things and not get really overwhelmed with all the things you could possibly do. So you're going to hear a lot of ideas here today. The action plan is set up to take in a lot of ideas and help you organize a large amount of information. But just be thinking a little bit about what's something, you know, not necessarily super forgettable or small, but what's a reasonable size initiative or project or activity that you could undertake, even if it's just starting with the collection of data about what's going on at your health center as it relates to retention.
And so
Definitely.
This is Pamela, where I always beam in and say that self-assessment tool that's also on the website that you can access is a wonderful starting place for collecting that data and thinking really concretely and having those early conversations with the rest of your staff and your leadership and your line staff to start focusing in on what are some of those salient issues that come up in the conversation in doing the self-assessment that take you over to thinking about what you need to include in that retention plan. And as Allison said, what really rises to the surface as the number 1 or 2 things that you want to tackle first and importantly.
Great. So, you know, again, the biggest thing that really can improve retention is having a clear mission that is aligned with the mission and vision that providers have for their own individual practices. So a lot of practices actually don't have a mission statement. You may or may not have one, but even if you do, you should take a look at it and make sure it's written, for one. And in developing it, it needs to be developed by a broad representative team. So you should include at least, if you're small enough, you can include everyone. But if not, then you should include representation from each type of position. If you're in different sites, you should include representation from each of the sites that you're in as well. And then once you've developed it, you need to communicate it to all of the staff and the patients. It's good to have it framed up on the wall in the staff room, in the waiting room, anywhere that people can see it to remind you of why you're there. And you also should revisit it annually if possible and review it. And if nothing else, it's a reminder to everyone that this is why you're there and this is what you plan to have for your values and goals. But also, if things have changed or you found that you need some types of revisions to it, you've given everyone the opportunity to participate again in that process. Then when you're interviewing staff, you need to include it in that interview process for all staff, not just providers. Okay, next slide.
Before we go, I wanted to add, you know, I think mission is something that we talk a lot about when we talk about recruitment, but not necessarily something we talk about in retention. In recruitment, we always seem to talk about let's recruit for the mission, let's find people who are motivated by the mission. We sometimes say, you know, let's give folks a mission discount on what we're willing to give them in terms of salary. And so mission is very prominent when we think about why people would want to come work at our health centers and how we can find the right fit for our health centers. But I'm sure many of you are familiar kind of with that feeling of, great, we've recruited you on the mission. Now that you're here, please take all of your, you know, productivity expectations and get to it. Here's your roller skates, as Pamela likes to say. And so we really want to think about how the mission is flowing, as Patty says, from, you know, internal culture to your your interview process and then back through your onboarding process and kind of your ongoing retention goals with your supervisors and colleagues and all of those things. So how can we really make that mission a living thing that helps keep people engaged at work? And I don't know, Pamela, do you want to share your story of kind of writing a mission statement that does some of the work for this?
From when I was doing the strategic planning.
Yes.
Yes, thank you. I have so many stories. And a shout out to Amelia, by the way. Nice to see your name on here. Well, I was doing a strategic planning with a health center, I think in Michigan, and they were saying that as we were going through looking at the mission statement, and all health centers have to have one and do have to revisit it, as Patty said, and the chief medical officer, as they were crafting this new mission statement, raised her hand and said, well, I can't recruit on this. I need to have something that says to the prospective recruits, not just this is what we do, but also onto the vision statement so that they could see this is where we want to go as an organization, and they can look at where they want to go as an individual and see if those align together. So she was really making a very strong point of it, not just on the recruitment end, but making sure that it contained things that they looked forward to accomplishing together as a retention tool as well.
Great, thanks, Pamela. We also just had a question come in about this. Who are you directing the you to in terms of roles or positions in the organization? And also many health centers struggle with the team concept. Pamela or Patty, do you want to elaborate on that a bit?
I know that Pamela has done a lot more work in this area than I have, but typically the you would be the leadership, the broadly defined leadership. However, the mission statement should be developed by a much broader group than just the leadership. It should be representative, as I said, of every individual position and each site. But Pamela, you probably know a lot more about this than I do in terms of governance and mission statements.
Well, I mean, I tend to approach strategic planning in general as a very broad thing. It's like I feel the more perspective that comes in, and the more that you're particularly involving, you know, if we're talking about developing the mission statement, certainly involving all of the staff at different levels, because their input is important, and also their understanding that what they want to be doing is consistent with what the organization is doing or what they think they're doing. So there are different tools just on that side of who should be involved in developing a mission statement. There are certain tools you can use that really make it easy to get input from everyone. There's different approaches. But I think in terms of doing the overall retention plan, doing the self-assessment, as broad of a group as you can get involved to get as many opinions and perspectives and experiences, because not everyone knows what it's like on the floor of the health center or sees what's going on in the waiting room that has impact, or as Patty said, how does scheduling work? How does the team work? And are things structured in a way that actually make things flow and comfortable for the providers as well as the patients? The patients are
right. In terms of the assessment, definitely, yeah. When we go in and do assessments, we talk to everybody that we can talk to.
I don't know if that answers.
Sometimes you get
what I said, not what you said. Your answer is perfect.
Well, and we can also think about this kind of activity, you know, developing, redefining, engaging with your mission statement as the kind of retention and culture building activity that you may be looking for to really try something. You know, putting some effort behind having a lot of group conversations or individual conversations with large swaths of people about what they think the mission is, how they see it working or not working in action in their daily lives at work. A lot of those conversations between supervisors and colleagues can help you get a better sense of how the mission is working and how it's not, and how communication about that mission is perhaps not always where it should be, and we'll give you some good ideas about how to really strengthen that throughout all levels of your organization. So if you encounter some of these ideas, this one specifically saying like, oh, we don't have the team necessarily already, or we don't have this already, look at how you can use the process of developing this as an activity in and of itself to build culture and retention.
Great.
So we'll take additional questions on that. Of course, please keep them coming, but I'll move us along to compensation now, Patty.
Great, thanks. So there's a part in the plan to document basically your compensation process. You don't necessarily need to put your compensation levels in there, but when did you last review provider salaries, if you ever have? Are those salaries competitive in the local market? You need to conduct salary reviews, and when you conducted those, you should include those as part of your recruitment plan. The nice thing about the retention and recruitment plan is that if you keep everything in one place, then when you go to recruit, or if you're trying to retain someone who's thinking of leaving, you have all the information in one place and at your fingertips that you can more easily respond to either of those events. You should have a provider compensation plan. Most places don't have a written provider compensation plan, and the problems that can result from that are inequity of compensation, or potentially people holding it close to their chest. I talked to an SQHC recently where only the director or the chief executive officer had information about the compensation plan. There were many disgruntled providers because they felt compensation wasn't equitably being determined, but really had no way of knowing that. So develop a compensation plan. You don't have to have the details in your retention and recruitment plan, but you should have a plan in place for how people who are currently being compensated are compensated and those who are coming in, particularly because when you're trying to be competitive, you may change the way you do compensation with new people coming in, and then as a retention effort, that can be a large failure because the providers that are currently there may feel that they've been overlooked in some way. So this would be a great time to review your compensation policies and strategies, make sure they optimize provider retention, and do all of that before you start recruiting. Because if you're not competitive, this would be the time to take a look at everyone's salaries, not just trying to be competitive with the new person coming in. So also be sure that a compensation plan is reflected appropriately in your provider contracts. So just don't start kind of mucking around with new people coming in and then see you have a problem with the contracts of people who are already in your practice. So the other thing you should do is consider provider incentives. More and more compensation across the country is being based on incentives. It's also a great way to take a look at the goals that you have at your health center and try to put the incentives in places that will help you meet your goals. So if production is an issue, you might want to incentivize, which is the most common incentive. May not be in the future, but still the most common incentives are based on production. And those might be based on either production based on revenue or the pure number of visits, or they could be based on relative value units. But if that's an issue that you have and your providers are not as productive as you'd like them to be, you could offer incentives in that way. Much more coming into the fold are those incentives based on quality, patient satisfaction, and internal administrative task completion. So quality might be based on how well you're meeting your PQRS indicators, meaningful use indicators, or whatever current quality improvement projects you may have in place. If you're working on hypertension or diabetes, you may provide incentives to those providers who make larger improvements than other providers. Patient satisfaction survey results could be part of your provider incentive package. And then finally, or not finally, but the internal administrative task completion is becoming a more powerful tool for provider incentives to make sure they signed off on their charts, that they've answered their calls, that the tasks that are really involved in high quality care are being completed. And then another opportunity to provide incentives would be an end of year bonus, which doesn't happen as frequently. But some of the best provider compensation plans may involve a combination of each of these. So that's something to consider. The other thing, when you're doing a compensation plan, especially if you're making large changes or moving from a straight salary to an incentive plan, excuse me, is to make sure you involve all of the providers in the planning and get their buy-in before you make changes. You should create the compensation policies in advance of making any of the changes and use very specific formulas so everyone can understand. I always think the simpler you make it, the better you make it. So use specific formulas that are understandable and write out the definition so that everybody knows what the changes are and that it's clear to everyone and they can understand it. You should also test it in advance. So many practices conduct shadow modeling, which would be producing reports that would show providers, for example, over the next 3 months, if you do this, this is what you will make. And then actually following it over those 3 months without changing compensation, but showing them this is what your salary would have been. In that way, you can see if you have any data issues, if there's some concerns about fairness in whatever formula you've chosen, and you can run basically a mock compensation change without anyone being harmed by it, and so that you can work out any kinks. And then get feedback and adjustment again prior to full implementation to make sure everybody's on board. Okay, next slide.
And I'd also add, if you need some information, kind of that first bullet, provider salary review, reach out to your primary care association. Several different PCAs conduct their own state salary reports that your organization may have participated in. If they don't, they may have partners in the state that they work with to kind of get some more information. So, sometimes it's difficult to get real-time, real-live information kind of on what the competition and marketplace is, but those partners are great places to start in order to figure out kind of where you really should be.
Great. So this is related to compensation. Sometimes benefits is equally important as actual dollars that are being spent in salaries. You should do a review of your benefits. You should know what all of them are. Again, it puts it in one place so that if you're talking to someone on the phone and they're asking you that you're trying to recruit and they're asking you what your benefits are, you'll have it all in one place. Not in a great amount of detail, but you'll be able to find it kind of a quick summary. The other thing you should do with your benefit review is start asking around. You can't really ask around too much about compensation because you can run into some issues in terms of price fixing. So you do need to be a little careful even with benefits, but you can ask around if you're at a conference, so they're not necessarily F2HCs you'd be competing with. Ask what they do for educational leave and educational travel. Do they offer disability insurance? Get an idea of, and NAC may actually have some of that information as well. So it's worth kind of checking around, see what is going on, but it's also worth talking to practices that are not part of NAC or that are not federally qualified health centers, because we know your competition isn't necessarily with just federally qualified health centers. You're competing with any position that another provider could get. So to get an idea about where you fall, and then write in the details on this chart, review your results in comparison to what you think the competition might be, and then try to highlight, again, as Allison said, you can choose small areas, or maybe there's something really big that's preventing people from staying or from coming to your organization, and take a look at how much that might cost your organization or what changes might need to be made so that you could try to accommodate that and create an action plan. Next slide.
And we do have a, it's kind of like a sample benefits package online on our website at chcworkforce.org. We'll give you, we did kind of a sample of, it's really a recruitment offer letter, but you can use the same template to think about what benefits you could or should have, as well as how to really package them for retention. You know, we know a lot of folks do kind of end-of-year benefits write-ups to say kind of this is the dollar figure associated with all the benefits that you received this year, and figuring out ways to communicate out the value of all the benefits that you have put together, more so than just the first time that people accept a job or get notice of a new benefit. You want to keep reminding people that it's there and that they should take advantage of it, but also that you've provided it so that it's something that's helpful to them.
Great, thanks. Work schedules are a huge area for provider retention and also recruitment. In particular, you may have a provider who comes on full-time and then has some kind of a change. Perhaps their family is expanding. Perhaps they are closer to retirement. Excuse me, I want to cut down. Maybe their kids are going to school and they wouldn't mind increasing hours, but they would want to work within the context of the school day. So many health centers only hire full-time staff, particularly for physicians, but it's worth looking at hiring part-time, which can include job sharing, or having flexible schedules for people who are full-time, which can expand the hours in your in the health center if people are willing to work longer days but maybe fewer days of the week. There are a lot of advantages to part-time or flexible schedules. Flexible schedules can offer more coverage. For example, if rather than hiring a full-time provider, maybe you have the funding to be able to hire 2 providers for 3 days per week each. So 2 at 60% time rather than 1 at 100% time. That kind of schedule can be really attractive for young parents or, again, older providers that are beginning to ramp down their schedules. But the big advantage from your perspective in terms of administering the schedule is that you could potentially overlap those providers by a day on a busy day, Monday or a Friday. Or you could have one work on a Saturday, which lengthens the number of hours you might be able to be open. In addition, they might provide their own internal vacation coverage or sick time coverage if you work out a deal with them that they are job sharing. So if somebody needs to take time off, the other person needs to be available. So it gives you lots of management options in terms of scheduling them. In addition, if flexible full-time schedules can give you more evening hours for providers who might want 1 day off a week, and can provide a lot more flexibility for the patients coming to your practice. But you do need to be careful that you take a look at patient and support staff schedules so that these innovations can still make sure you have enough patient appointment access and enough staff to cover those additional hours if you're expanding your hours. Anything that you guys want to add before I move on?
Well, I just wanted to reiterate that I think job sharing is a wonderful opportunity to blend the lifestyle preferences and needs of different segments of your staff in general, and that when it's done as a conscious sharing, you really do get the benefits at the same time of provider-patient continuity. It's, from a patient satisfaction perspective, it offers them the same provider, even though it's in 2 bodies. So they're not feeling like, gee, it matters on what day of the week they see anyone who happens to be the part-timer. But it really does, as Patty says, it allows the the person who wants to be home in the morning to read the paper like me, the opportunity to just do that, but I don't care if I work late, because what the heck, I eat dinner at 8 o'clock anyway, but if I had young kids, I'd want to be at that soccer game. But they're out of the house by 7:30 in the morning, so I can be there. I think it's a wonderful new opportunity. Certainly there's complexities around benefits and other things, but I think it's really worth looking into.
And I would just add the work schedules piece is another piece that you want to think back to the mission engagement section. You know, as we see different generations and people in different parts of their life in the workforce, I think we've been hearing a lot more about this idea that perhaps people who want more flexible work schedules or different kinds of work schedules don't have as much commitment to the mission as other people who maybe have already spent a long career working long hours without some of these benefits. And so navigating the internal culture and ideas about what it means to be committed to the mission and what you as an organization see as commitment to the mission, that's going to be, you know, kind of a tricky, somewhat emotional subject to manage internally, but we find that that pops up a lot between providers and between administration and providers about what kind of counts as engagement in the mission. And so thinking again as you're building some of these incentives, you know, actual incentives like work schedules, how does that fit back with what you're trying to accomplish? And how can you demonstrate that no matter what a person's actual schedule, them being there doing high-quality work is really what you're looking for as part of that mission engagement?
Exactly.
Well, and I would add to that when you've made the effort to meet people's needs through flexible scheduling, they tend to make the effort back to actually be more involved because they're grateful for that. And in addition to maybe ensuring their commitment or increasing their commitment level, it also can be a bargaining point. If you just can't increase their compensation to be competitive, this is a huge area for people who flexible schedules can be more important to them than their overall compensation package. So it's a great place that may not even cost you anything to just be, and it may actually reap you a lot of benefits to be able to be a little bit flexible with schedules.
You know, I think in general, and I'm thinking back, Patty, to what you were talking about in terms of incentive packages and stuff, that some of the things that I feel are really consistently clear when Allison and I are going around the country talking to people is the idea that, you know, kids today, as they say, but people today have a very different idea of what's important. And balancing. And so when we talk to people about like recruiting through Fly Fishing Magazine, it's also the same with and Allison has said this a lot before when we're out on the field, health centers have, you know, we think of only their disadvantages in terms of retention and offering and compensation, but they have a lot of benefits that other organizations can't offer, particularly as those organizations are becoming bigger and bigger systems and more rigid in what they can do. A health center really does have more opportunity to try stuff, you know, customize stuff, go back and change things. I have a health center I'm working with in Pennsylvania. They're trying the 4-day, 10-hour day approach. But they're, like you said, they're piloting it. If it doesn't work, they're going to go back to the other way. They have that opportunity to try and to be flexible and to really offer some of those intangibles that larger systems can't, that are really more appealing.
Right, and can really help with the work-life balance, which I think a lot of people are looking for. Especially, we find that, you know, physicians only stay on average about 3 to 5 years, and often that's when, for nurse practitioners, it's even lower. It's about 1.5 years. But and that's kind of the average turnover rate at FQHCs. But for those providers that are in 3 to 5 years, often that's when they may be starting young families if they're new grads. So flexible schedules can really make a difference for trying to hang on to them.
Yeah, I mean, there's a couple that we've been around talking with, and you know, they shove early extended vacation time. They're like, you know, I'm going to offer my folks 3 weeks to start and 4 weeks after 3 years because it's really important to them, and they'll stay with me if they have that extra time. And as you pointed out at the beginning, Patty, it's so much cheaper, less expensive to keep. So, you know, thinking, and I think that's part of the strategic thinking around retention, is that not what do I need now, but what is it going to cost me over the next 10 years to do recruitment?
Right, and a lot of those costs are intangible. I mean, there can be permanent harm to your health center if there's too much turnover. It's not just the tangible costs of, you know, how much is the locum going to cost and how much revenue might I be losing. It might also be more permanent costs in terms of not trusting quality or continuity. So, yeah, this is really critical.
Your patients. Yeah.
Right. So another area, and the final one we'll talk about in terms of specifically to recruitment that we want, retention that we lined out, is trying to develop a career path. This can be really difficult if you're a small health center, especially if you're in a rural area that doesn't have as many opportunities. But it's definitely worth looking at, and it might be an area where you could make really big strides without doing a whole lot of effort. So some career path activities that we've identified to put into the retention plan to start thinking about are whether the providers are able to provide clinical oversight within the organization. So maybe they come in and then they can move up the ladder towards medical director. Is there a ladder to move up, or is there, can they be a team leader if you're doing team-based care? Then another type would be administrative oversight, again, looking at what programs and services they might be able to provide oversight to if they have that, inclination. And then the more obvious ones are teaching opportunities. And this is a place where, again, you can make big strides. There can be teaching opportunities with medical students, medical residents, advanced practice nursing students and residents, physician assistants. And you may not be near a teaching hospital or near a medical school, so those teaching opportunities might be more difficult, but it doesn't mean they're not still available. There can also be telemedicine opportunities and how to work that into a career path. And there are, we would love to hear if you have others as well. We'd like to be able to come up with a compendium or catalog of what all of those types are, and we're working on having a resource for that at the STAR Center. But for the retention plan, you should be looking at, do you do any of these things already? If you do, how is it working? Could it work better? Talk to the providers about how it's working. You can't just on a leadership level make that assumption. And again, identify what are the things you would change, where could you make some improvements, and put those in the action plan so you can work on them.
Another place you might think of going to is, you know, and I'm so glad, Patty, that you mentioned the telemedicine, because you can really, you know, you can become a leader in even academic settings or teaching or mentoring through telemedicine. We usually think of it just for how do we deal with patients' needs. But another place, too, is allowing people to specialize and become champions within the health center for a certain outcome, disparity, illness, or something that they have a particular interest in. So if someone has a really big interest in type 2 diabetes or TB or whatever it might be, really giving them the resource and the time to explore whatever that condition or quality measure is, or whatever that lights their fire. And so that becomes
right. And consider joining an action learning collaborative in the region, or starting one, and that's another way that people can get more satisfaction from their positions.
a key way to know any of all the stuff that we're talking about in terms of what's working, what's not working, what people might be wanting to know is really engaging your managers and having them engage all the folks that they're working with. So provider staff, who are your providers reporting to? If they're all your CMO, what opportunities do they have to chat with your CMO? Do you need to think of additional structures so that they can engage with leadership and others on how they're feeling about all of these things? I think the general wisdom in all jobs, not just at health centers, not just for providers, is that people don't leave jobs, they leave managers, and they leave bad, administrative relationships. And so, one technique, for example, in combating that is engaging with stay interviews. And so the concept of stay interviews is kind of doing what you do in an exit interview, only doing it before they leave. So talking with your provider staff, all your staff, but for the sake of this conversation, speaking with your provider staff about what's working, what's not working. These would be weekly or monthly conversations that just really get to what's frustrating them, but what's making them really happy at the same time.
That's actually a good segue into our next slide.
Sure. I think we actually have a poll quickly for our next slide. No, that's okay. I will leave everybody in suspense on the stay interviews and the dissatisfaction piece, but we're going to have Mariah right now launch a slide for us. And this one is really going to focus on what we just talked about, the 5 big buckets that we talked about, and thinking about your own situation. So which of the previous 5 topics you currently kind of struggle with the most? And we're interested, now that you've heard us talk about what each of them means, what you'd say, and then we're also going to be using some of your feedback today to think about what additional resources or training or webinars or whatever we can provide to you to help you tackle some of these questions. So think about what you've heard today and what you might want some additional assistance with. Of course, we're always here by phone or email, but moving forward, we'll see what your answers are. And Patty, I'll turn it to you.
Yeah. So it looks like benefits do not appear to be an issue for the folks on the call, and the mission less of one. So it looks almost even for compensation, work schedules, and career path, which is interesting because sounds like your missions, which tend to be the biggest issue, if you feel fully aligned with that, that's great. You're halfway there. So hopefully we can help you with these issues.
Great news. The hard work's over, friends. You've done it.
So when we did the assessment portion of in our last webinar of the retention and recruitment template, we really ran out of time to adequately cover this last part, which was provider dissatisfaction and satisfaction. So I just wanted to, hopefully we have a little time left to kind of delve into this again, and Allison was just alluding to it before, how important it is to keep tabs on provider satisfaction all of the time to help avoid retention issues before they occur. So it's important in terms of the stay interviews, exit interviews, satisfaction interviews, and we'll get into that a little more, but there are other things you can do beyond interviews to keep tabs on people and see how they're doing. But the main reasons for provider dissatisfaction, I'm just going to review very quickly again: lack of training of staff, lack of partnership between support staff and providers, workload, need for better facility flow and infrastructure, lack of power to make improvements, not being heard by management, the financial considerations that we just reviewed, and scheduling issues that we just talked about. Move ahead. So we've talked a little bit about interviews, satisfaction surveys, but there are other things you can do to measure and promote provider satisfaction. I think the most important thing is that you should measure and promote provider satisfaction. And I know that it can get really busy and it can be really hard to kind of take a step back and do that. but providers are like any other employee. They need attention. They need to know that they're valued, and they oftentimes may not feel that they have a voice to talk to you about concerns that they have. So it's really important to do provider satisfaction surveys, at least on an annual basis. But it's also important to have regular evaluation meetings one-on-one with providers, because getting the information in a survey may be in an anonymous way, and then it might be more difficult for you to follow up and ask questions, or maybe address an issue that's only an issue for an individual and not for the other people on the staff. It's also great to do a lot of social gatherings. You could have them with just the providers or with the support staff too. I would advise a combination. Holiday parties, summer barbecues, things to just celebrate, because that way people become more invested. They become more invested in all the staff as being part of their community, inviting their significant others, their children, and pulling them in, particularly when, which is most likely the case, you've recruited people whose main family or main home is not in your area. It's really important to pull them in. We'll talk a little bit more about that in the recruiting section of this. But social gatherings on a fairly regular basis that are interesting and fun to staff can not only give you that family intimacy amongst the staff, but also provides another vehicle to talk on a more casual basis about things that may or may not be working in the practice. And finally, if it does come to the point where someone is leaving for whatever reason, you really need to do an exit interview. People avoid them because sometimes they just don't want to hear what's going on, or they think they can guess what's going on, but they really might not know. So it's incredible information. Often people will tell you things on an exit interview that they might not have communicated thus far, especially if you do the exit interview with someone who is not their immediate supervisor. And you get invaluable information. You probably won't retain them on an exit interview. You're probably not going to be able to make changes at that point. But it will give you information that can help your improvement process so that other people don't leave, and to make it easier to recruit people in and keep them. Okay, next one. So just to wrap up, we were focusing on key issues for provider retention. Again, collecting data and identifying the areas that need improvement are important. This plan should not be put up on a shelf. That's why we made it in Word. We made it easy to revise. You should be always looking at your action plan, making improvements, and then going back and revising your plan. And this should assist you in developing strategies for better retention. The next steps for you would be to complete your retention plan. So you need to communicate your results to the practice team, develop an action plan, implement it, and then update it. And the next steps for all of us are to do part 3, which will be the recruitment plan. We're going to talk about the steps that are actually involved in recruitment. You may all be familiar with those. Hopefully we'll be able to give you some more tips as well as maybe provide some insight into some areas. And you may be able to offer us some information as well.
Great. Thank you so much, Patty. This was great, and we're perfectly on time. We don't have any remaining questions in the queue right now, so if you think of any as you're going through the retention plan, please just go to our website, chcworkforce.org, and hit that Contact Us button. You can fill out a form. You can call us. You can email us individually, whatever you want to do. We're here to assist you fill out that plan, but assist you with any other recruitment retention issues you may want to talk through. We're looking forward to having you in December for part 3 of this series. On this, that part's really going to focus on the recruitment process of your plan, and we'll close out with the tool. So the tool itself is available on our homepage, as are the slides and recording from the part 1 of our webinar series. We'll add the other recording and slides here, and you'll also get them via email. So if you're signed up and you were joined us today, you'll get information on the 3rd webinar automatically, and we will look forward to talking with you then. Thank you so much.